Good morning, everyone. Thank you all for joining this morning. I'd like to turn things over to Governor Mills.
Thank you, Dr. Shah. Well, these past few weeks have seen, I think, great progress in vaccinating people against COVID-19 here in our state and in other states. So yesterday we had our best day ever in getting shots into arms with more than 15,500 reported vaccinations. We're very fortunate at the same time that the federal government has stepped up the production of vaccine and has committed to increasing our supply in the weeks to come. With nearly 19% of the people in our state having received at least one dose of this life-saving vaccine, it's time to turn our attention again to the economy. For the past year, economists have told me repeatedly, if you want to restore the economy, deal with the pandemic first, because you can't have a healthy economy without healthy people. I believe that we are at last on our way to doing just that. This administration's approach to the pandemic has been simple. Do everything we can to save lives. And as we focus on public health, we have also balanced that with our economic health, saving people's lives and protecting their livelihoods to the greatest extent possible. Today, we're taking another step to stabilize Maine's economy while protecting the public health. It's been a long, hard winter, but spring and summer are right around the corner. You can almost feel it in the air. A change in the weather also means that we're approaching tourist season, a crucial time of year for so many businesses and for our state's economy as a whole. We want our state to be both welcoming and safe, to make sure we can live up to our vacation land brand and reassure all visitors that Maine wants them to be safe while they're here. And so I am unveiling today the Moving Maine Forward plan. This plan is our approach to public health and to protecting public health and supporting Maine's economy. The plan has three primary parts: maintaining critical public health measures, establishing standard capacity limits and timelines for those across the state, and updating our travel policy to allow freer travel in and out of the state of Maine. So first, maintaining public health measures. Even as we vaccinate more and more people, we know that COVID-19 and some of the emerging variants remain a serious health risk, and that the best way to head off that threat is to do a few basic things. We all should wear our mask, watch your distance, avoid crowds, and wash your hands frequently. Over the past year, we've worked with different sectors of the economy to develop and implement specific public health measures for their businesses and activities. These measures and the protocols for specific activities, when they've been adhered to faithfully, have worked. The US CDC and the Maine CDC tell us it's important to stick with those measures. They're common sense. So under the Maine Moving Forward plan, we're maintaining those critical health and safety protocols that have protected people over the last year, like wearing face coverings, keeping physical distance, et cetera, and the specific COVID-19 prevention checklists, which are critical to keeping businesses safe for Maine people and reassuring visitors that they'll be safe in our state. These protocols provide a critical level of protection, and businesses have successfully implemented them over the year. Secondly, establishing standard capacity limits and timelines across sectors. This plan, the Moving Maine Forward plan, also makes major changes to our indoor and outdoor capacity limits in the coming months. First, we're moving away from that hard cap capacity limits, the 50 person limit, for instance, we've had across most sectors, to a percentage model, percentage of space model. Secondly, we're establishing a time frame to increase capacity limits across all economic sectors to provide a measure of uniformity and predictability. So for all indoor gatherings, limits will increase to 50% of their permitted capacity starting March 26th. And assuming all goes well, that limit will increase to 75% starting May 24th. So March 26th, it goes to 50% of your indoor capacity limits, and 75% starting May 24th. For all outdoor gatherings, capacity limits will increase to 75% on March 26th and to 100% starting May 24th. For all outdoor gatherings, that will increase accordingly. So this timeline provides our hospitality and retail and other industries with a clear idea of what to expect. of course, we retain the flexibility to adjust these figures if necessary. For example, if things go south on us, we could dial down the capacity limit from 75 to 50%, or if a new variant strain poses a significant risk to public health, something unexpected at this time. But we can all avoid this scenario by getting vaccinated and continuing to take all safety precautions, not letting down our guard. I should also note we plan to open bars and tasting rooms on March 26th as well. Many of these businesses have been operating takeout service or have offered outdoor seating or have adopted restaurant protocols to open their doors. This change will allow those who have not yet opened their doors to open to indoor service again within the public health protocols for that particular business. So, travel policy. The third thing that the new plan does, it updates our travel policy in both the short term and long term, and it'll reflect changes in the coronavirus pandemic since last summer's tourist season. Currently, everyone who comes into the state of Maine must either test or quarantine coming into the state of Maine or returning to the state of Maine, unless they're from a state that's specifically exempted by the Maine CDC. Currently, that's New Hampshire and Vermont only. Effective today, immediately, we're adding Massachusetts, Connecticut, Rhode Island to the list of states that are exempt from that requirement. So people can now move freely among the New England states without testing or quarantining. In addition, people coming from other states outside New England will not have to quarantine or have a negative test if they've been fully vaccinated or if they've recently had COVID-19 and have recovered. These individuals are no longer required to test or quarantine when coming into Maine, regardless of the state of origin. But keep in mind, there are some federal requirements that relate to international travel, and those, of course, remain in effect. Now, that's immediately. May 1st, we're going to shift that travel policy from an all states included unless exempt to a all states exempt unless included model. Let me be a little clearer about that. That will mean as of May 1st, all travelers from other states can come to Maine without having to test or quarantine unless they come from states that are determined by the CDC to have a high prevalence of contagion, COVID-19 variants. If one or more states see a spike in the variant cases, Maine can and will reinstate the test or quarantine requirement for those travelers from that state or for Maine people returning from that particular state. Right now, Maine, adjusted for population, ranks second lowest in the nation in total hospitalizations. We rank third lowest in the total number of cases and fourth lowest in the number of cases from COVID-19. We want to keep it that way. We want to have those good case numbers. Our 7-day testing volume is 8th best in the nation. And our positivity rate over the past 14 days is second lowest in the nation. We've administered more than 391,000 doses of vaccine, and more than 253,000 people, or almost 19% of the population, have gotten their first dose. And more than 138,000 people, or more than 10% of the population, are now fully vaccinated. According to Moody's Analytics and CNN Business's Back to Normal Index, Maine is the best in New England, and we're 18th best in the nation in returning to pre-pandemic economic activity. We're making progress in putting a lid on this pandemic. Of course, it's not over yet, but by maintaining proven health measures, by providing straightforward protocols, and establishing clear timeframes, the Moving Maine Forward plan will protect the health of Maine people and visitors alike and support Maine's economy during what we hope will be a robust and welcoming tourist season. I'm excited about the coming spring and summer, as I hope you all are too. Please, if you haven't done so and if you're eligible, get your vaccination. Please comply with the basic public health and safety protocols. Help us return to normal, return to those activities that we all want to return to, and have a great We'll have a great economy, a bustling tourist season this summer. I'm looking forward to that. And I'm so proud of Dr. Shaw, Commissioner Lambrou, and so many others in the business community and the employee community who have helped keep Maine people safe. Thank you, Dr. Shaw. Commissioner Lambrou is also here, and I think Commissioner Johnson, and we'd all be happy to take a few questions.
Thank you very much, Governor. The first question for the morning goes to Patrick Whittle from the AP.
Thank you very much. I would love to know, do these new gathering standards, these also apply to religious institutions? Is that right? Or have those changed in some other way?
No, these would be these would be a uniform capacity limits across all sectors.
Okay, terrific. And when do these go into effect?
Well, for indoor gatherings, the limits will increase to 50% of the capacity, the permitted capacity. Usually, fire marshal's office determines that. 50% of the permitted capacity starting March 26th, and that would increase to 75% of the permitted capacity May 24th.
Okay, terrific. Thank you very much.
Thanks, Patrick.
That timeline kind of, I hope, comports with the anticipated increase in vaccinations and lowering of case counts, lowering of hospitalization counts, and increase in vaccination, roughly comporting with that timeline.
We turn over to Morgan from WABI next.
Hi, Dr. Shaw, Governor Mills, thank you for taking my questions today. So my first question is with this new timeline, do you anticipate making essential workers and pre-existing medical condition, those types of categories of people, do you expect them to be eligible sooner to ensure that they are vaccinated before more people are coming into the state?
Well, we're expecting everybody to be eligible for a vaccination fairly soon. I mean, given the increase in production of the vaccines, and given the president's prediction and commitment, in a few short months, everybody will be eligible for the vaccine. We are still working through the 70 and above and 60 and above, and some healthcare workers and first responders who haven't yet gotten vaccinated, because they are, first of all, first responders, public safety, health and safety issues there, and the older people who are more likely to get very sick, become hospitalized, and even die if they contract the virus. Those are still our priorities. As I said before, I dislike the term essential workers because I think everybody in Maine is essential. The work that everybody is doing is essential work. So we have not adopted the categories from the ACIP. And clearly people with underlying conditions of various sorts are very concerned, and I sympathize with that. I cannot imagine. I get emails and letters from people with various conditions, and we will vaccinate you. We will offer the vaccination to you. At some point soon, nearly everybody in the state will be eligible for vaccination.
Okay, yeah, I meant the people who were deemed essential, like grocery store workers, and now thinking of people who work in restaurants, who may be around more people. And it seemed like yesterday that there was a possibility that we might not be able to get. We were unsure. It sounded like yesterday that you were Dr. Shaw. You said that you were unsure that we would all adults in Maine would get their first doses by the end of May.
Maybe I can jump in for a second, because I had a conversation with the CEO and president of Pfizer 2 days ago, along with a handful of other governors, and they are committed to a couple 100 million more doses in the coming months. That, along with the commitment of J&J partnering with Merck to increase their production, leads me to be optimistic about the flow of vaccines into our state and into all states in the next couple of months.
And I had a question too.
I didn't want to jump over. Dr. Shah, you may have other insights.
No, nothing further to add, Governor.
And a question about workers coming into Maine. We see a lot of workers obviously coming into Maine during the summer months. Would they be eligible to get a vaccination if they had not previously gotten one?
Generally speaking, if they're coming from other states, they're probably going to be eligible for vaccination in their states before they get here. I think it's fairly likely. We haven't discussed whether those coming to the state that have not been vaccinated would be eligible for vaccination in our state. Just haven't discussed that. Generally speaking, our vaccination policy is reserved for residents, broadly defined as people who are here and expect to stay here, not for short-term visitors or itinerant workers. But we'll be looking at that, assuming we can get Maine residents vaccinated as quickly as possible.
Thanks, Morgan. Let me turn it over to Dustin next.
Thanks. Is more coordination and communication from the federal government what's allowing this plan to form compared to what it was like last year? Is it a better understanding of COVID-19? Because throughout 2020, when restrictions went into place, there were fewer timelines as specific as this one that was released today.
Well, throughout 2020, I mean, really, the vaccines didn't really come into play until December. Our first delivery of vaccines wasn't until mid-December, I think. So that didn't become a factor in what we do with various protocols and restrictions until that time. But the discussions we have with the White House now, I think I have to say that they are forthright. If there's something they can't do, they'll tell us. For instance, the other day and last week, concerning the J&J vaccine, they said, well, we can allocate another X amount for this particular week, but then it's going to go down and then hopefully up again. So they weren't making empty promises, but I think they're good for their commitment. And in speaking with other governors, they have gotten what they expected to get from the federal government at the same time that we have.
And then what was the effort like to create these guidelines? Who has your office been talking to over the past few, I assume, weeks on this?
We've really been talking to the same people for the last year about various protocols, guidelines, checklists, capacity limits, travel policies. And Commissioner Johnson, if she's on the Zoom, she might be able to address that too. We get information from all kinds of sectors and interest groups and individuals constantly.
Yeah, Governor, I am here. Thank you. Yeah, we actually take feedback across the board. There were some associations that help aggregate feedback. We actually reach out intentionally to business owners from diverse parts of the state to make sure that we're getting geographic representation in those discussions as well. And then try to do group calls with different sector representatives to make sure that we are understanding all of the elements of things that are important to them. And then we work closely with Commissioner Lambrew and Dr. Shaw and their teams to try to put together the best outcome that balances public health and economic health.
Thanks.
Thanks, Dustin. Let me turn it over to Amy Brown next.
Thank you, Dr. Shah. So prior to May 1st, the testing and quarantine requirements are immediately lifted for people who are fully vaccinated coming into the state. But I just want to make sure I understand this right. After May 1st, vaccination status doesn't come into play at all, and the whole system shifts to open travel for anyone coming from states that are approved by Maine. There'll be a list of specifically excluded states. So
Yeah.
Does that mean that people who are fully vaccinated from an excluded state have to quarantine and test, and people who haven't been vaccinated at all, but they're on our okay list, can come into the state without any restrictions?
Dr. Shaw.
Sure. Thanks, Amy. Two subparts to your question. So for those individuals coming in from let me first talk about the states that may appear on the excluded list. We've seen that there could be states out there that have epidemiological parameters that suggest they have not maintained a tight grip on the pandemic. And so if that were to happen, if the staff at Maine CDC were to find that or see that in the data with respect to a particular state, that state would be on the you must now test or quarantine list. Absent that, individuals can come in. But residents of those states who find themselves on the no longer exempt list, if those residents have been fully vaccinated, they can come in without testing or quarantine. So does that answer your question?
Yeah, that answers one part of it. The other part is the other states that have been authorized, there will no longer be any need for them to say that they've been fully vaccinated before they travel to the state, and also no quarantine or testing requirement.
That is right. That's further on in the summer, but you are correct.
Okay, and what about families who are traveling with children that haven't been or can't receive the vaccine?
So right now, even our testing and quarantine guidance really just applies to adults right now. And so that won't change even with the vaccine.
Okay, great. Thank you.
Yep, thanks, Amy. Let me turn it over to Mal Weary next. Mal? All right, we'll come back to Mal in just a second while I turn to Lori from the BDN. And Lori, you'll have to unmute yourself, please.
Okay, can you hear me now?
Yep, loud and clear.
Yeah, okay. I have two questions. The first one is whether you have any trigger numbers for what might cause you to pull back from any of these advancements.
So,
Good question.
sorry, Governor.
Go ahead, Dr.
Yep,
Shah.
so as we've done with the current analysis with respect to which states can be put on the exempt list, it's a blend of different factors, Lori. Some of them are quantitative, some of them are qualitative. The quantitative ones include things like comparing the positivity rate, the rate of new cases, as well as the rate of hospitalizations and deaths in other states relative to Maine. The principle being, if residents from another state pose a significantly higher risk of having COVID and thus bringing COVID here, they may be on the list. But there are qualitative factors as well. Let's say there was a very, very large outbreak in a concentrated part of that state where we know a lot of tourists happen to come in from. That would factor into our decision making as well. This is the same approach that we've taken throughout the pandemic in making these assessments. Now it just carries forward for now a second summer.
Okay. And the second part of the question is more for the governor. If you could talk a bit more about reopening the bars and tap rooms. They generally have small footprints anyway, so I'm not clear how this will benefit them, even when they reopen inside, because it seems like they would have a very limited capacity anyway.
I'm not as familiar as you might think with all the bars and tasting rooms in Maine. I haven't been to all of them, only a couple. But no, you're right. Some of them are small spaces, and they're going to have to gauge accordingly, work with us and their local authorities in addressing these limits. But it's a percentage of their permitted capacity, not a raw number. So, but you're right. The 6-foot distancing is what's going to actually inhibit some of them from opening as widely as they would like. But again, you know, in the coming months, hopefully they'll be able to open outdoors and indoors and combine those spaces and accommodate more people. We do want them to be able to reopen and do business within the public safety protocols, public health protocols. They're there to protect everyone, including their own staff, and their customers and the general public.
So the March 26th reopening, is that for indoors?
I'm sorry.
For the bars, is the March 26th for indoors?
Yes.
Okay. Okay. Thank you very much.
A lot of them are doing takeout, bar takeout. Mr. Dow is rolling over in his grave, but takeout service for bars has become a thing now, and in accommodating the outdoor service.
Thank you very much.
Changing
Thanks,
their
Lori.
paradigms.
Let me see, let me turn back to Mal Weary. Mal, are you with us? All right, we'll turn it over to TJ Tremble while I check back on Mal. And TJ, you are muted.
Okay, I apologize for taking so long. I just had a couple of quick questions. One, do you have a target date for when there's 100% capacity for indoor outlets?
For indoor?
Yeah, right now, the way I understood it, with 75% for indoor beginning May 24th.
That's correct.
Is there a point down the road where you're going to say, okay, June 1st, 100%?
Well, that would only give us a week to look at things. So no, that's rushing it a little too much there, TJ. No, we think this will give us time to evaluate the data, evaluate how businesses are doing and how they're protecting the public health. Obviously, they're still under some pretty strict public health guidelines, protocols. I think, last summer, an interesting thing occurred. Last summer and fall, people did come to Maine. And people are going to continue to come to Maine because I think they understand, I know they understand that we are pretty much the safest. We like to think of ourselves as the safest state in the country now. We have good COVID numbers. We've done a great job with cooperation from the public and the business sector. Great job keeping our case count low and increasing our vaccination rate now. Plus, we have the lowest crime rate, lowest violent crime rate in the country, and the second lowest property crime rate. All those kinds of things contribute to a brand that is very truthful and very welcoming to people to come to Maine. A couple of things we can't control, couldn't last summer, can't this summer yet anyway, is the cruise ship traffic. We don't know what's going to be allowed for cruise ships, whether cruise ships are going to be coming here or not. You saw what Canada did. And secondly, the Canadian border. The Premier Trudeau and the President, the national folks have got to deal with the Canadian border. I'm sure that depends in part on how the provinces do in vaccination and in their case counts. But, I wish we could just lift the Canadian border and allow it. About 17% of our overnight guests over the summer come from Canada. That's still an inhibiting factor in our economy, but I can't change that on my own. So those things still exist, but we're very optimistic about going forward. And right now, the increase to 75% for indoor gatherings and 100% for outdoor gatherings starting May 24th, I think is a good measure, a good step forward.
And with outdoor gatherings, as you mentioned for indoor gatherings, that's across the board of whatever type. Does that, for outdoor gatherings, does that include, the extra large ones like concert venues, which oftentimes can have 15 to 16,000 people jammed into a place?
Well, they can't, that's the problem. They can't be jammed into a place, TJ. We are increasing the capacity limits, but there's still the public safety, public health protocols. And that involves distancing. If you and your family go to a concert, you and your family are sort of a cohort. You stick together, but you're 6 feet away from the next family or next grouping, the next individuals. That's going to be a limiting factor in itself.
Thank you.
Thanks, TJ. Let me turn it over to Ann Burliant next.
Thank you, Dr. Shah and Governor Mills. I have to say most of my questions have been answered. The questions have been really great, as the answers have been. I do have one. It's relating to the new guidelines that are coming up. Would it make sense for someone to plan a large scale, say 200 people destination wedding in Maine for this summer?
Makes sense. Only if you're getting married.
Guidelines.
Yeah, sure. Why not? We hope we will have. We hope the wedding industry will make a comeback. I'm very hopeful of that. Of course, it depends on the venue and the accommodations, and people need to plan ahead and consider the public health protocols that are in place for those events anyway. But yeah, we want there to be weddings in Maine. We want to brag about our state. We want to be vacation land and maybe wedding land and venue land. I think we welcome people to come here for their weddings.
Thank you very much.
Thanks, Ann. Over to Eric Russell next.
Thank you, everybody. I have two questions. I think the first one might be for Dr. Shah, so I'll start there. I know that as more and more people are vaccinated and the state is focusing on those at highest risk of illness and death, we're hoping to see hospitalizations and deaths really come down. But cases, there may be a risk that cases overall go up as things open up. And I wonder if you've given some thought about how you assess new cases and the trend of cases as you consider reopening these things.
Yep, absolutely, Eric. So, one starting note, cases themselves have come down since the peak in early to mid-January, and different epidemiologists have pointed to different multiple factors as to why that's happened. But the beginning of the vaccination process is part of that. Even since then, cases have slid a little bit as vaccinations have continued. We think there's good reason to think that that trend will continue. Of course, there are some signs that we are looking at as well, but the link between increasing vaccination and decreasing case counts is one that we are trying to assess and figure out how much of one is causing the other. But generally speaking, Eric, one of the other findings from last summer was that a lot of the activities that that the governor announced that we're moving back toward can be done safely thanks to the continued adherence to common sense public health measures like masking, like physical distancing. Indeed, that's one key reason why those are not going away. But with those measures on board, gatherings of different sizes at different times can be done safely. We've seen that. Are they uniformly safe? No, there's nothing that's uniformly safe, but we can try to have both. We can try to have gatherings that allow us to get together while keeping rates of the virus low. Now, we're thinking about how we look at these data in an era where more folks are being vaccinated, where there's more activity, but the fundamentals won't change. We're still going to be looking at the same parameters, things like case rates, positivity rates, hospitalizations, and sadly deaths.
Thank you. And Governor Mills, I wanted to see if you could comment on the budget that's making its way through the Senate, specifically the piece that includes, I think it's going to be somewhere between 300 and 350 billion for state and local governments. Now, I know what you're announcing today is aimed at helping the private sector and the tourism industry and the restaurant industry, et cetera, that has really taken a hit. But as you well know, states and local governments have taken massive hits too. And I wonder if you're concerned that what you're announcing today doesn't necessarily get them back in the green and away from the red.
Well, great question, Eric. Thank you. We welcome any and all federal assistance in helping our economy rebound, helping our tourists and hospitality industries make a go of it this summer big time, and look at issues regarding childcare and other things that are impeding people getting back to work. And that's why we've put together a biannual budget that includes a lot of measures to help people get back to work. But we welcome any and all help from the federal government. Look, I started reading the bill last night. I only got to page 585, and it's not clear to me, there are tax credits for this and that. There's money for broadband, apparently. There's a lot of specific initiatives in that bill. And then there's some money for local governments, county and local governments, and state governments. There's some provisions that say this money is to prevent layoffs for public employees. We're just trying to wrap our arms around that. And, we invite, what I would propose to do is talk to the Appropriations Committee about those funds once the Congress does pass something. It's not clear to me what they're going to pass. I'm not a predictor of congressional action here, but I'm hopeful. But there's nothing specific we can count on or budget for yet. Looking forward to that.
Thank you both.
Thanks, Eric. Let me turn it over to Megan at WMTW next.
Thank you for taking my question. This is similar to Eric's first question, but perhaps worded maybe the opposite way. But how much of this plan is really contingent upon the vaccine being delivered as has been promised? We've seen how much vaccine comes into the state vary. Sometimes it's increased, sometimes it's decreased. For example, this week, which is to say, if it doesn't happen as we all hope, do we have an idea how and what would be rolled back first?
Oh boy. Well, that's kind of speculative, to be honest. I have no reason to doubt the president of Pfizer, who told us directly the other day that they were going to ramp up production and do X number by March, X number at the end of March, X number by April and May. And I have no reason to doubt President Biden and his administration and the CDC, the new CDC director, and others whom I've been speaking with every week about their predictions or commitments to ramping up the vaccinations. Dr. Shaw deals with his compatriots in other states and at the federal level as well, regularly, and gets the same kind of information that I get from my sources. Go ahead, Dr. Shaw, if you have something to add, please.
No, Governor, I concur. Again, we can't speculate as to what the vaccine supply may look like, but all signs point to the supply increasing and increasing significantly toward the end of March and then throughout. That coupled with other things that we've learned, for example, the fact that, as I was in connection with Eric's question, noting the fact that because of the continued adherence by those who are out there, whether they be tourists or Maine people, as well as, and importantly, the thanks to the business community for sticking with these public health guidelines, we've seen that activities can be done safely, relatively speaking. So that coupled with the vaccine provide us the headroom that we need to move forward.
And I will just add that the vaccine is significant. That's the game changer here. We know it works. We know it's effective. And we know that we're now, as Governor Mills said, almost 1 in 5 Mainers have had their first shot. That's going to only grow over time. And we do believe both the president of Pfizer and the president of the United States that supply will increase. And that changes the projections. We now can more safely project what the summer will be like this summer versus next summer and give that kind of planning horizon with this tandem public health protocols, which we know from last summer can work, plus vaccination, which we know is highly effective.
Let me turn next to Marissa from WGME.
Hi, Governor Mills. I know you said the mask mandate remains in place. Are there any plans to lift the requirement that they be worn outdoors?
We don't plan any changes to the mask protocol, the mask requirement at this time.
So it will still be, if you're anywhere outside where you might encounter someone, people should still continue to wear masks?
Well, if you're alone and you're on the Appalachian Trail, I mean, common sense has a role to play here, of course, but nothing has changed, and our protocol in that respect is based on the science and the data, based on the federal CDC recommendations and national consensus, basically.
And when it comes to people traveling to Maine, those who've been fully vaccinated or have recovered from COVID-19, will they be required to show any sort of proof, the way people did with a negative test?
Right, I think maybe Dr. Shaw or Commissioner Johnson can address that because we've talked about that quite a bit.
Yes, so the vaccine or the recovered from COVID piece will be added to the certificate of compliance, which is a document that the visitor would attest to when they arrive. And it acts in the same way as somebody who had received a test or had quarantined. So that document will continue to exist and has been updated and is available now.
Let me try Mal Leary one more time. Mal, are you on today? Okay, well, we'll get Mal's question answered. With that, the last question for the morning goes to Jackie Mundry.
Thank you, Dr. Shaw. This question I think is for Governor Mills. So the effective May 1st plan, when Maine shifts the travel policy from an all states included and less exempt model to all states exempt and less included model, do we know what states might be on that, or are we waiting to see more data?
I'm sorry, do we know what again?
Do we know what states might be on the, yeah.
No, we may have a better idea come May 1st because we'll have a history there, we'll have an experience or an analysis of other states to better decide that. Nobody jumps out right now, and we'll wait until May 1st until we figure out what states, if any, are doing so poorly that they should be subject to requirements before they come into our state.
And then just one more question. Obviously, the summer camp industry is a big industry here in Maine. Does this affect them at all? Are they going to be able to have more kids this year?
We certainly hope the summer camps will open. And I think Commissioner Johnson has been dealing with their national and state associations, and they've been helping us develop good protocols that they can work with. Commissioner Johnson, did you want to say anything about that?
Yeah, no, thank you, Governor. Yes, we actually met with them even as recently as yesterday to look at the individual pieces of the protocols that will help them operate safely over the summer. I think we all see the value in having these, high quality experiences for children to work through the summer. And we believe our summer camps will have real options, both the day camps and the overnight camps to operate. There's still some details that we'll work through as we move forward.
Thank you. Governor, Jackie's question was the last one for the morning, so I'll turn it back over to you.
Oh, okay, thank you. And just briefly, last summer we saw a lot of people getting outdoors in Maine, coming here to enjoy our great natural resources and our environment. And I think that's going to happen even more so this year. Last year, we saw a huge uptick in campground usage by people in Maine and out of Maine. I think 62% of the campgrounds were reservations from Maine residents. A couple weeks ago, the campground reservations opened up in the first 18 minutes. The reservations blew off the charts. So very hopeful about that industry. I'm very hopeful about the tourism industry and about retail and about businesses generally in Maine. A year ago, we were sitting here talking, we were down to the MEMA operations doing our press conferences there, and things were not nearly as hopeful. Things were, not fun. And none of this has been fun, but I'm so glad that things are changing, are turning around. And I'm so excited about the coming months and people coming here and enjoying Maine for everything that it offers. We welcome them. We want them to come here. And we want Maine people to be safe first and foremost. So thank you for listening. Thank everybody in the Maine public for contributing their ideas, contributing their observations and thoughts. We take everything into consideration as we take these measures step by step. We're reopening Maine. Maine is open, and you're more than welcome to come here and hang out on the beaches and mountains and hotels and restaurants in Maine in the coming months. Thank you.
Thank you very much, everyone.